conversation coming up.
Okay, so I'm going to take this microphone. I'm going to bust it up a little bit because that's the way we do it in Kentucky, because we are from the Big Blue Nursing Nation, and we are after our national championship. Love you guys, University of Virginia, but we're going for it. University of Kentucky, Wildcats, we're on it. So I just want to tell you a little bit about my connection with less cancer and how I met Bill Cousins. And it was when I was actually the Associate Dean of Academics at the University of Virginia, when my dean, and you all probably still remember her, Dr. Dory Fontaine, was at a football game with Bill. And she heard Bill talking about his organization. And she just perked up. She goes, "Do you know about my researcher, Janie Heath, and her work with tobacco control?" And Bill said, "No, I don't. I want to meet her." And it has just been the most wonderful journey since then. So it's going on year 10, actually. And we started this partnership. And just as Dr. Michael Swanberg brought all of you from the University of Virginia, that's what we started doing 10 years ago. We'd load up in the bus and come up here and have so much fun. So I'm so glad to see that that tradition continues. I've been passionate about tobacco control all of my nursing career. So I'm going on 43 years. My mother died from brain cancer when I was 10. My father died from metastatic lung cancer when I was 30. My mom was a one-day-a-pack smoker. My dad was a two-day-a-pack smoker. So I go to the University of Virginia, and I'm out to just save the world and just do all kinds of great things, because you know the belly of the beast is right there in Richmond, Virginia. So I had lots of great experience, lots of great impact in making a difference here in the Commonwealth of Virginia. And now I'm at the University of Kentucky, where we got some problems with tobacco in Kentucky. We have among the highest smoking rates in Kentucky and the highest lung cancer rates in Kentucky. And I never thought that I would be selected to be the Dean of Nursing at the University of Kentucky because of my work, but I was. And I had the great honor of walking into an amazing environment of colleagues in my College of Nursing and at the University of Kentucky who are experts in the field with tobacco control. So I would like to introduce one of our leading experts with the youth, with you guys, to see what she's doing to help us address the epidemic that we have going on with our youth that are juuling and vaping and everything else, and God knows what's in those products. So can I ask Dr. Melinda Ickes to please come forward? And I'm going to have you just stand there at the podium, if you would. So let me tell you about Dr. Ickes. She is actually an associate professor and director of graduate studies in the Department of Kinesiology College of Education at the University of Kentucky, and she has a joint appointment with us in the College of Nursing as the co-director of our tobacco control policy research program and director of Go Tobacco Free Kentucky. So this is a little bit of a change what I'm going to be doing, but I have recruited some students, haven't I? Yes, I have. So I would like the student that has question number 2 to please come forward, and it's going to be fun. It's all good.
We're just rolling.
It's all
with
good,
it.
and just have a seat right there for me, because what we're going to do is when I call on for question number 2, we're going to hear this young man's full name. We're going to hear what school he's from and the town. We know it's from it may not be from the great state of Virginia. So you get it all out there, then he's going to ask a really hard question, Dr. Ickes. But not yet. And I have another volunteer for question number 3. Would you please come forward and have a seat at the front? That's it. Here we go. See, look at them. They had no idea. I know their teachers are just ecstatic that I've put them on the spot like this. We're having some leadership development. Thank you so much. And then we have someone who has question number 4. I believe it's over here somewhere, or over here. Yes, come on. Have a seat right up there. There we go. And then I've got question number 5. Here we go. Now that worked out pretty good. I did not handpick them. I just asked them to work it out at each of the tables. So we've got great representation. Are you ready, Dr. Ikes?
I am so ready, and this is more my jam. So
this
no
is her
offense
jam.
to the adults
this
in
is
here,
what she
but
does.
I like working with the young people and talking with them. So it's kind of weird that we're side to side, so I might be looking at them. But, they're the ones that we really need to talk with about this issue, so I'm so glad that you thought of this.
Well, yes,
Love
I
it.
did. Okay. So I'm going to do the first question, though, to get it going. So we have heard all of the news. It's just been really... it's been very disturbing, very sad, shocking to see how many individuals have literally died from vaping. So my question to you is the news, is this fake news? Or is it blown out of proportion? What's all the hype? Is it hype with marijuana in some of the products? Or is it hype with the flavoring? You tell us, give it to us straight up.
Yeah, you know what? I wish I could say that it was all hype. Unfortunately, we've seen such a dramatic increase in young people using e-cigarettes and vaping. And how many of you in the room know somebody who uses e-cigarettes or vapes? Or you've seen a story about someone in the news who has used an e-cigarette or vaped, right? So it's really interesting because when we look at data from 2018, the report was about 3.5 million young people. So that means middle schoolers and high school. Many of you same age, right? We were astounded by that number. And then the most recent data came out in 2019 from national data, and we know that over 5 million young people are currently using e-cigarettes. And when I say they're currently using e-cigarettes, that means they're not just trying it, right? That means that they're repeatedly using in the past 30 days. So unfortunately, it's still an issue. The other thing that is important to consider is these products are changing daily. So while we were talking about Juul, which is one brand of e-cigarette a couple of months ago, we're now talking about things like disposable e-cigarettes. And so we have to keep up with the times because those numbers are going to keep going up if we aren't doing something about it.
Thank you. So now for the student who has question number 2, would you tell us who you are, where you're from, and if there's any stumbling with the question, it's because my handwriting is not really super good. So take it away.
My name is Dominic Ruiz. I am a senior at Albemarle High School in Charlottesville, Virginia. And my question is, why do you think the use of e-cigarettes and vaping has become so popular with youth?
I should be asking you all that question, right? So based on what we've learned, some of the main factors have to do with the appeal. So the first brands or the first design of e-cigarettes actually looked like a traditional cigarette. And so when those came out in 2011-ish, it really didn't take off among young people. So when these really sleek designs, you've probably seen them, they look like flash drives. They now sometimes look like key fobs. They look like those things that go on the back of your phones, the little wallets. When those sleek and innovative designs came out, youth were wondering, what is this? And so the design is one thing. The other thing that's really important when we're talking about young people has to do with flavors. So you might be surprised to learn that there are over 15,000 flavors of e-cigarette juice or e-liquid, which contains all the chemicals and the nicotine. Why in the world we need 15,000 flavors is beyond me. So when we're talking about flavors and we're thinking about fruit flavors, candy, many of you have probably heard of flavors like gummy bears, cotton candy. There are things called unicorn poop, zombie dust. That's certainly not geared towards the 45, 50, 65-year-old individual who may have been a smoker. So the flavors are really important. We know that actually over 80% of young people who start using any tobacco product use a flavor. And so that's why the whole idea of a flavor ban or legislation that includes all flavors is so important, including menthol. We also know that they're pretty easy to use, these new designs. So you can take a quick puff and then you can put it away and somebody might not see it. There's also ease of access. So that means they've been fairly easy for young people to get, which should be really concerning to all of us, right? We should not have a 17-year-old, 18-year-old being able to walk into a gas station or convenience store and purchasing these on their own or ordering online. The other thing is we know that they're really good at marketing. If we could kind of take some lessons on how some of these corporations who are promoting not so healthy products, they're doing a great job. So when the original marketing came out for some of these pod-based e-cigarettes, they were using bright colors, they were using young people, they looked like they were having so much fun. And so of course, that's gonna help young people to be curious about these products. And then the other thing I want to mention is the idea of social norms. So if you think that everyone is doing it, you may be more likely to try something, right? And so now in our day and age with social media, how many of you in this room have Snapchat, Instagram, TikTok, which I'm now learning about thanks to working with all the young people? So what they're telling me is, it's hard to go on your Instagram or your Snapchat and not see a story posted by another young person that's showing them using these products. And many of you are shaking your head because you've probably seen those. Well, these industries also pay what we call influencers. Anybody know what an influencer is? Yeah. So they're paying them to, post pictures of them using their products. There was actually a really interesting study that came out that there were over 1 million YouTube hits of people using e-cigarettes and vaping. So all of those things in combination, I know that's a really long answer. It has to do with why our young people are using these products. The good thing is those are all things that we can change. Those are all things that you all can make a difference in. And to say, enough is enough. We do not support these efforts to market towards us or to manipulate us. So I'm so excited that there are so many young people in the room because I hope you get fired up when you leave here today and then email me or call me and say, okay, I'm ready. What can we do?
Okay, now we're going to get a little bit harder with our questions, Dr. Ickes. So question number 3.
Good morning. I'm Anna Grace Tomlinson. I'm a senior at Highland School in Warrenton, Virginia. My question is, you've done research with e-cigarettes with high school students transitioning to college. What did you learn from your research?
Yeah, so we did a study on our campus where we were looking at students transitioning from high school, so many of you similar age, to freshmen. And so they were traditional students. And we really wanted to know, so what's going on with this whole e-cigarette epidemic? And this was about 1.5 years ago now, which is crazy to think how fast time flies. But we found that almost a half of those incoming freshmen had ever used one particular brand of e-cigarette, which was Juul at the time. Think about that. Almost half. So when you think of the young people coming out from high school and you know that they're already using these products on college campuses, we certainly have some work to do. We also found that there were certain risk factors. So there's been a lot of research related to combustible cigarette smoking and other tobacco products and the risk factors. So with e-cigarettes, it's a bit different with young people. We know that white Caucasians are actually more likely to be using. Now, things are shifting, so this is always, something that we have to keep up with. It was also really interesting that those who intended to join a fraternity or a sorority were 4 times more likely to be current users of these products. And so that makes us go back to that whole social influence and, just thinking about the belonging, the connectedness, and how that could be really playing a role with this issue. The other thing that was really shocking to me is the current users had been using 20 to 30 of the past 30 days. So when we looked at current users, we found that over a third, so 33-ish%, were using 20 to 30 days. So just think about that. If you know what these products are like when we're talking about the pod-based devices like Juul, they have these little cartridges or pods, right? And so they have what we call e-liquid that contains nicotine, and that little pod contains the equivalent of nicotine of at least a pack of combustible cigarettes, when we think about our traditional cigarettes. And so there's a lot of nicotine in these pods, and young people are using more than 1 pod a day. And so that risk for dependence becomes really concerning. The other thing when we're talking about dependence is many of these incoming freshmen were using other substances. So current users were 6 to 8 times more likely to also be current marijuana and current alcohol users. And so when we're talking about substance use and substance dependence, it's really hard to talk about one product in isolation. And a lot of the things are similar when we're talking about prevention, which I know we'll get to, but we need to work collaboratively to truly see a difference. And then finally, our lessons learned. This is something that students, incoming freshmen, they were initiating over time. So as they had other influences, like their social influences, some environmental influences, they were still likely to they were still likely to initiate throughout their freshman year. So we had such a large population of young people that were already using, but we still had to worry about prevention. So it reinforces the importance of prevention, but also treatment.
Thank you. So let's shift gears a little bit for question number 3.
My name's Joe DeWolf. I'm a junior at Highland School in Warrenton, Virginia. And my question is, what are some of the misperceptions young people have about vaping?
Yeah, what are they, right? So, I think one of the biggest things that the media and the industry, the industry has done a really great job of is saying, these are not that bad for you, or they're much safer than combustible cigarettes. And that's a message they want to get across. Why? Because it helps sell their product. But we now know, there's research coming out every single day. I'm the kind of person, do y'all know what Google alerts are? So I get Google alerts for e-cigarettes and vaping. You can imagine how many hits I get every single day. But it's hard to keep up with the research because so much research is coming out on the health effects of e-cigarettes. And reputable research, from people that have been doing research for a long time. And so while the long-term evidence takes a while to get out there, we know enough, and we know that these products are not harmless. And it's important to consider that less harm is not the same as no harm. We also know that these e-cigarettes contain a lot of different chemicals, and because we're kind of in flux right now with the regulation and kind of when we're talking about how these products will be regulated in the future, we really don't know what's in them. We couldn't list all the chemicals, we couldn't list the percentage of nicotine concentration, but we do know that there are cancer-causing chemicals in many of the e-liquids that have been studied, which when we're talking about cancer prevention, that's really an important point. We also know, how many of you have heard that it's water vapor that comes out? Anyone? Yeah, guess what? It is not. So we know that it's aerosol, and aerosol contains fine or ultrafine particles, which are really easy to inhale into your lungs, deep into your lungs. And we also know that these chemicals, or the aerosol, when it's emitted, it contains chemicals. It can contain things like fine or metals. And so one of the things that I think is you're going to hear a lot more about in the coming months is this idea that you, the bystander, you're being exposed to secondhand aerosol. So if your friend is using and you're breathing that in, you're actually being impacted, whether you realize it or not. And so that's something that I think you can take back with you, hopefully, and it resonates with you because we've learned so much about secondhand smoke exposure, and I feel like people are really good at articulating why they don't want to be around secondhand smoke, and now we're talking about secondhand aerosol. So those are some of the health misperceptions. I also think that there's a perception that everyone's doing it. And a lot of that is perpetuated by social media. And, what we do know that if young people believe that everyone's doing it, they are more likely to try it. And so how do we shift that gear and say, guess what? I'm not doing it. You're not doing it. There are more of us who are not doing it than who are. And so that's a message we need to get out as well.
So we've got the $1 million question coming up with number 5.
Hello, my name is Abigail Fielding, and I'm a senior at Monticello High School in Charlottesville, Virginia. And my question is, what will help combat this issue, and is there something to help treat those that vape?
Yeah, so my first response is you all are the answer to helping combat this issue. Every single one of you in this room, you can help educate, promote awareness of fact-based information. You can have conversations with your peers, with your parents, with your administrators, your colleagues. I think we need to have open dialogue. But we do know that several things work. So for years, we've studied tobacco prevention in schools and with young people, and we know things that when we talk about refusal skills, decision-making, how to empower young people, all of those things resonate and actually last long-term. And so right now, for example, we are working on an e-cigarette prevention and empowerment program. It's called I Can End the Trend. Oh, I'm sorry, I'm supposed to say the hashtag I Can End the Trend. And so I have had the most wonderful experience working with young people. And so working with college students who help develop and design this program to be relevant for young people. Because guess what? I mean, I still like to think I'm cool and hip, but I'm getting to that point where I might be over the hill. So I need to know, how do we talk to young people about this issue with things that are going to resonate with them? I can talk about the health effects all day. I can tell you the statistics. They're not listening, right? You all might be, right? Because you're way up here. But we know that most people, that's not going to really stop them from trying these products. Things that stop them are, again, those refusal skills, feeling empowered, understanding that they're being manipulated, how much they cost. And so those are all things that my college students helped me to integrate into our program. So trained college students go into schools, elementary, middle, and high schools, and we do a prevention curriculum. The biggest piece around that is that empowerment. So, and I love that I've heard that from several of the speakers today, because we really can empower you all to be the change that we wish to see. The treatment piece is also important. So while we're talking about prevention, we know that so many young people are already using and they are dependent. So they're having physiological withdrawal when they are not using these products during the school day. And so how can we support them and set them up for success? And so there have been, just really in the past 6 months to a year, there have been a couple of national programs that have been launched. Truth Initiative has one. It's a text-based program. And then National Jewish also has one called My Life, My Quit. And so we're realizing that while a lot of the same lessons we've learned with tobacco treatment for adults and young people are similar in terms of the approaches, we need to get down on the level of young people and communicate in ways that they understand and ways that they're used to by texting and bots and videos. And so some of these new platforms integrate those strategies. And then finally, this is a really long-winded answer. We know that policies help, and we all need to be advocates for these policies. So when we're talking about flavor policies that include all flavors, including menthol, with no exemptions or no loopholes for these little lovely disposable e-cigarettes that we're now seeing pop up everywhere in our schools. We also need to think about taxing these products, at the same level or parallel to how we're taxing others. And then we need smoke-free policies in our communities. They need to be comprehensive, and they need to include e-cigarettes. And similarly, in our schools, we need tobacco-free policies, and we need to make sure that there's support for implementation. We need to make sure that we're offering that treatment and that they're also being really clear on what products are included, like e-cigarettes. And then we also need to go back to that treatment, and treatment becomes so important. And so do we have the resources in place? Do we have, in each school, in each county, is there someone that's trained that these young people can go to? All of those things have to happen for us to make a dent in this epidemic. But I think with all of us in the room, those are certainly possibilities.
So thank you so much. How about if we give a round of applause to Dr. Ickes and our fabulous student panel? You guys are awesome. I hope that your teachers are taking note, and it's going to be an A for today for you guys. So do we have time for one or two questions? Or?
But I want to make sure we get a picture with everybody.
Oh, yes.
We have time for questions. Does anybody have a question for any of the doctors, students? Right over there. Can you stand up and just shout it out?
When you say taxing, so you say like making them more expensive, don't you think that could possibly make it easier for people to like black market and stuff like that and make it more poisonous? So don't you think we should focus more on the health side of it and focusing more on
Yeah, I think that is a wonderful question. And when we saw the kind of the vaping epidemic come on the news, where we're talking about lung and respiratory illnesses, a lot of it came back to find that, young people were buying things on the black market, if they call. That is one facet of the e-cigarette epidemic. And I think we do need to engage young people, but we need to look at all of those strategies to see what's going to be most effective. And it's probably not going to be just taxing things, right? At the same time, we need to be to ensure that we're in the schools, that we're educating, that we're having young people understand the facts about these products, and that they're, potentially putting themselves more at risk if they're purchasing products from, not necessarily a convenience store or a gas station. But at the same time, we know that those products that are being sold in stores where it's legal, those are still not harmless. And so I think that's a message that got mixed a little bit with the media, focusing so much on these deaths, it's awful, and it's something that's very concerning. But the nicotine-containing products also have a lot of harm, and those are products that can be purchased legally. So I totally understand what you're saying, and I think it'll take all of us to figure out that solution.
Right there in the white sweater. You want to stand up and shout it out.
So I know how you touched on a big part of it was kind of social norms. And for the youth that want to speak out and the student leaders that want to speak out against it, is there a way that they can speak out, or have you thought of a way for them to speak out in a way that doesn't get them criticized by their peers?
That's a really good question. And that's something we hear in the schools quite frequently is, there's something, I want to do something about this, but I'm a little afraid to stand up. Am I going to be bullied? I think we are the ones that have to change that culture. We're the ones that have to be the leaders and to say, it's okay not to use these products. And there are some really great videos out there where we have athletes talking about, how this impacts their athletic performance and why they don't want to use them. We've also had individuals who have used these products and become dependent. If anyone has heard of Luca Kennard, he's my favorite. He's a young man who's in high school, and he talks about his story, and he talks about how he became so dependent on it. But guess what? He flipped that narrative, and he is now an advocate, and he works with organizations like Campaign for Tobacco-Free Kids and Truth Initiative to share his story and to use it as a platform to say it's time for all of us to speak up. So, not everybody has to go through this. But I'd love to chat more about ideas.